AIDS on indigenous populations. We realized that we have money in the budget for a validation workshop, but we did not have a study to be validated. So we've had to use our minds to see how we can use our committees to do this, to contribute to this study, both the committee on and the committee on indigenous people, so that when we get to the validation workshop, we can have a consolidated approach to this issue. The third part of my report is my work as a country rapporteur. In accordance with Commission's mandate under Article 45 of the Charter, the Commission has an important role in monitoring the implementation of the Charter by state parties. In this regard, under the 5 member states assigned to me, namely the Arab Republic of Egypt, the State of Eritrea, the Kingdom of Eswatini, the Republic of Gambia, and Republic of Sierra Leone, I was seized with a few matters. Let's start with the Arab Republic of Egypt. Over and above dealing with communications from this nation, I was able during the meeting on hepatitis B, to contact the head of the Human Rights Council in Egypt, and we were able to meet and had a very resourceful discussion on how we can engage this country moving forward, considering this was my first trip to Egypt after assuming this role. With the Kingdom of Eswatini, we are just recovering from the experience of human rights defenders issues in the country following the death of the murder of the human rights advocate Tulani. But during the same period, there were other incidences. For example, the Commission learned that the conviction of members of Parliament Munduzi, Bakede Mambuza, and Mdendi Dube in June 2023, nearly 2 years after their arrest, has not been resolved. The concern on Eswatini continues to overwhelm us, as the process is now also being handled by the SADC Troika, and we believe that a solution will be found on the ground. Just to mention that we could not go further because the country was heading for an election and in September, and with an approaching election, we had to wait, pull back. We had wanted to hold our conference on HIV/AIDS ahead of ICASA 2023 because the Kingdom of Eswatini has the highest number of incidences and preference of HIV/AIDS in the world, but we had to hold this back because of the elections. On the Republic of the Gambia, we, under Article 45(1)(c) of the Charter, we are required to cooperate with other African institutions concerned with promotion and protection of human and people's rights. And as part of my deliberate effort to engage with the state party to the Charter on the implementation of the human rights obligation to monitor situations during the intersessional period, I observed and monitored the report to the National Assembly of the implementation of the government's white paper on the Truth, Reconciliation and Reparations Committee, TRRC, recommendations that were delivered by the National Human Rights Commission. I noted with great interest the progress which that country has made in advancing human rights. We also participated in the National United Nations 75th this at some point, but it didn't materialize, and so we put our concept note on record. We had a downturn with this country when we had to do an expression of concern over female genital mutilations because of a parliamentary debate held in September 2023. This was well covered in the media. The Commission learned that a magistrate court in Koo and Kentu in the Gambia, in a landmark decision, commendably convicting 3 individuals for their involvement in the performance and complicity of FGM actions that directly contravene the provisions of Section 32A and B of the Amended Women's Act of 2015, had raised a debate which had the capacity to reverse the advances this country had made. So jointly with the country rapporteur for the Children's Committee, we wrote a joint letter of concern to His Excellency the President. Going to the Republic of Sierra Leone, during the intercession period, the Commission learned with much delight that the Republic of Sierra Leone successfully held general elections on 24th June 2023, pursuant to the National Constitution of 1991. The elections were declared free and fair by the African Union, as well as regional observers. Later on, there was an impasse between the winning party and the opposition, which was just resolved last week, where the 2 parties agreed to work together in a joint dialogue. On the Republic of Eritrea, during the intercession period, the report of Eritrea, draft report of Eritrea was received by the Commission. On going through this report, I noticed that there was nothing or little said about indigenous people, and so we addressed this matter by responding through a question for the Republic of Eritrea to pay attention to this matter in their final report. The 4th part of my presentation is just a quick overview of the situation of HIV on the continent in the context of the upcoming international conference on AIDS and sexually transmitted diseases that will be held in Harare, Zimbabwe in December this year. As member states are aware, the advent of COVID-19 has in many ways taken the attention from HIV and AIDS. So this section is just to remind us that HIV/AIDS is still a huge challenge, and the member states should not relax. 20 years ago, global AIDS pandemic appeared to be insurmountable crisis with 2.5 million new infections and 2 million AIDS-related deaths every year. Progress has been made, and people now with HIV/AIDS have a chance to survive only if they have access to services, to antiretroviral drugs, to good nutrition, and this is important. This section, I also wanted to highlight the fact that out of the top 10 countries with the highest incidences in the world, 9 of them are from the SADC region. And we want to use this opportunity to say that this has concerned the Commission, and we have approached also the Department of Health in the AUC to see how we can come up with regional champions at the heads of state level, starting with the SADC region and other regions to follow, so that we close in this threat. The fact that the disease burden, HIV disease burden, is disproportionately distributed in the continent is something that we believe should take political attention. In conclusion, I would like to say that we have a couple of recommendations to the governments. There is need to critically address the disparities in HIV/AIDS treatment and to ensure that everyone living with HIV/AIDS across the continent has treatment support, both at family level and state level. We believe that the app that we are championing would go a long way in helping member states reduce the cost of accessing people living with HIV/AIDS, because apps have been found to work where people do not have to get transport to go to a health center. They could be able to handle or order their drugs from the app, have a conversation with their doctors on the app, know their CD load on the app, and so we recommend member states to support this app when it is developed. We also believe that it is time to prioritize the HIV/AIDS vaccine as a continent. We saw how quickly partners put money on the table for CC to see how we can change our focus to deal with this matter. To the national human rights institutions, we advocate for protection of human rights, especially for key populations in the context of HIV and AIDS. This includes monitoring and reporting on human rights violations related to HIV/AIDS. Also to work towards legal reforms to discriminate key populations that are exposed to HIV and AIDS, and also promote awareness and education campaigns on HIV and AIDS-related rights issues. To civil society, and this is the last one, we call on civil society as the people that are on the front line of working with people living with HIV and AIDS to continue to implement community-based programs for prevention, care, and support for people living with HIV and AIDS. We are also calling on them to conduct outreach and education campaigns to reduce stigma and discrimination associated with HIV and AIDS. We also would like to call upon them to be our data collectors on the ground so that we can get operational research data to tell us more about what is happening to this disease, particularly during the period of COVID. And lastly, to ask them to continue advocating for the rights of the marginalized populations and those affected by HIV and AIDS, and to lobby policy organs for increased funding and improved access to healthcare services. Honorable members, I would like to submit this report for your kind consideration, and I thank you.
Merci beaucoup, Madame la Présidente du Comité sur le VIH-Sida. Nous n'avons qu'un seul État qui s'est enregistré pour ce rapport, c'est la République du Cameroun. Est-ce que la République du Cameroun est prête? Elle est là. Oui, Madame, vous avez la parole pour 5 minutes.
Nous vous remercions pour la parole donnée, Monsieur le Président. Monsieur le Président, honorable commissaire, la délégation camerounaise voudrait adresser ses félicitations à l'honorable commissaire pour sa brillante présentation et saisir l'occasion afin de présenter la situation des personnes vivant avec le VIH au Cameroun. Les données de 2022 estiment à 480 228 personnes vivant avec le VIH, avec un pourcentage de 95,8% de personnes connaissant leur statut sériologique, soit 460 088 personnes. Il faut toutefois indiquer que ce pourcentage varie suivant les régions. Le Nord, le Sud-Ouest et l'extrême Nord ayant les moins bonnes performances. On note une évolution dans la prise en charge avec 424 771 personnes vivant avec le VIH sous traitement contre 388 358 en 2021. Il en est de même pour le nombre de formations sanitaires offrant des traitements contre le VIH qui est passé de 848 en 2018 à 2909 en 2022. Au sein de ces formations, la gratuité de certains services est garantie, tels les antirétroviraux, les examens de suivi et les médicaments pour la prévention des infections opportunistes. Mesdames et messieurs, la pandémie mondiale à la COVID-19 a été un réel frein à la prise en charge des malades. Les mesures de distanciation, de confinement et les dysfonctionnements de la chaîne d'approvisionnement ont gravement perturbé les services impliquant les interactions entre les personnes. Cela a occasionné un ralentissement des dépistages, surtout en communauté, de la prévention de la transmission du VIH de la mère à l'enfant, du traitement antirétroviral, des programmes relatifs aux populations clés, la distribution des préservatifs, j'en passe. Afin d'y faire face, quelques mesures ont été appliquées, allant de la sensibilisation sur les bonnes pratiques en période de Covid, l'équipement de protection individuelle du personnel soignant à la dispensation à 3 ou 6 mois des antirétroviraux au profit des patients stables. Le rôle joué par les communautés en collaboration et en complémentarité des structures de santé est également à relever. En effet, elles ont largement été mises à contribution pour les services de proximité, en particulier pour ce qui est des groupes marginalisés et ceux vulnérables, ainsi que pour la sensibilisation sur la stigmatisation et la discrimination dont pouvaient être victimes les personnes vivant avec le VIH du fait de leur identification comme population qui connaissent une morbidité et une mortalité élevées liées à la COVID-19. Madame l'honorable commissaire, votre rapport faisant aussi mention d'activités menées dans le cadre de la lutte contre l'hépatite, la délégation voudrait saisir l'occasion afin de partager le communiqué du ministre de la Santé publique de la République du Cameroun, daté du 18 octobre 2023, qui indique que les patients souffrant de l'hépatite C peuvent désormais avoir accès gratuitement à certains médicaments, notamment le Sophos Burfir, le Daclarcasvir, 400 à 60 mg, boîte de 28 comprimés, qui coûtait 100 000 francs CFA avant, soit 161,501 $. Il a par ailleurs été publié la liste des sites officiels de prise en charge des hépatites virales sur l'ensemble des 10 régions que compte le Cameroun. Je vous remercie de votre aimante attention.
Merci beaucoup. Il n'y a pas d'autres délégations gouvernementales enregistrées, ni d'ONG et d'INDH. Je vais donc retourner la parole à Madame la Présidente du Comité sur le VIH pour ses observations conclusives. Madame la Commissaire, vous avez la parole pour les observations conclusives.
Thank you very much, Chair, for the floor. We take note of the comments and the information that the delegation of Cameroon has graciously shared with us, particularly on the data, on the work that the country has been doing, and we note that 95% of people know their status. This is very important because it shows that the government has been involved in making sure that people living with HIV and AIDS are able to protect themselves because they know their status. We note the country disparity in performance in poorer areas, and this is not isolated. It happens, and actually people who are indigenous and communities and minorities fall under this cluster. So we call on the member state to make sure that special attention is given to this particular marginalized communities and sections of the country. We note the improved coverage of treatment and the increase in the number of points, and we would like to congratulate the country for making sure there is free ARVs and STI, sexually transmitted disease medication, which helps deal with opportunistic diseases and reduces the. On COVID-19, we note the work the country put in place during the times of disruption of services, including social distancing and the decreased number of screening incidences, and we congratulate the country for the going out of its way during the COVID period to make sure that services were available to communities in the country. We take note that the country is already providing services on hepatitis B, or hepatitis in general, and we call upon the country to expand its services in this area, and we commit ourselves and the AU family that is involved in the research on hepatitis to continue working with member states. I thank you and thank the chair for the floor and take it back to him.
Merci. Un instant, on n'a pas encore terminé. Pendant que je vous ai remis la parole, j'ai reçu un État complémentaire qui voudrait intervenir au sujet de votre rapport. C'est la Tanzanie. Je vais passer la parole à M. Richard Kilanga pour 5 minutes sur le rapport du comité VIH-Sida. M. Richard Kilanga.
Asante mwenyekiti. Mheshimiwa Mwenyekiti, tunakipongeza kikundi kazi cha masuala ya ukimwi kwa taarifa yao na kwa kuitambua Jamhuri ya Muungano wa Tanzania kuwa ni miongoni mwa nchi ambazo zimepiga hatua kubwa kwenye swala la kudhibiti ukimwi. Kama ilivyoelezwa kwenye taarifa hiyo, wakati wa kukabiliana na ukimwi kuna masuala ya kijamii ambayo ni vema yakazingatiwa ili kuhakikisha watu wenye virusi vya ukimwi hawabaguliwi na pia wananufaika na haki za binadamu na watu. Hivyo serikali imechukua hatua stahiki katika kuhakikisha hilo linatekelezwa kwa kutunga sheria ya kudhibiti ukimwi, sheria ya kudhibiti ukimwi, sera ya kudhibiti ukimwi, kuanzisha mpango wa taifa wa kudhibiti ukimwi, kuanzisha tume ya taifa ya kudhibiti ukimwi, na pia kuwa na kamati ya kudumu ya bunge ya masuala ya ukimwi. Vile vile kwa upande wa Zanzibar kuna sera ya taifa ya ukimwi, sheria ya kudhibiti virusi vya ukimwi pamoja na mpango wa kudhibiti ukimwi Zanzibar. Mheshimiwa Mwenyekiti, serikali imezingatia maeneo mbalimbali ya watu wanaoishi virusi vya ukimwi ikiwemo haki ya kupata ajira. Katika sheria ya ajira na mahusiano sura ya 366 inatoa fursa sawa kwenye ajira na inakataza kumbagua mtu kwenye ajira kwa sababu tu anaishi na virusi vya ukimwi. Ambapo katika kifungu cha 7 kifungu kidogo cha 4 aya M cha sheria hiyo inakataza kumbagua mtu mwenye virusi vya ukimwi. Mheshimiwa Mwenyekiti, kuhusu haki ya kupata huduma za afya, watu wenye virusi vya ukimwi wanapata huduma bila malipo na jitihada za makusudi zinaendelea kuhakikisha kila kituo cha afya nchini kinakuwa na uwezo wa kutoa huduma kwa wanaoishi na virusi vya ukimwi. Aidha, hadi kufikia mwezi Machi mwaka 2023, idadi ya vituo vinavyotoa huduma ya tiba na mafunzo kwa watu wanaoishi na virusi vya ukimwi imefikia watu 7,072 kutoka vituo 6,919 mwaka 2021, ambapo sasa hivi jumla ya vituo hivyo sawasawa na vituo vya afya ambavyo ni 8,529 vinavyotoa huduma za afya nchini. Mheshimiwa Mwenyekiti, serikali ya Jamhuri ya Muungano wa Tanzania itaendelea kuchukua juhudi za kuhakikisha watu wanaoishi na virusi vya ukimwi wanachangia kwenye maendeleo ya nchi bila kubaguliwa, pamoja na kunufaika na haki za binadamu na watu. Asante kwa kunisikiliza Mheshimiwa Mwenyekiti.
Asante sana Mheshimiwa Kilanga. Sauti kwa dada Lita kwa jibu.
Asante sana kwa ripoti yako. Tumesikia vile Tanzania imejitahidi kuangalia maslahi ya watu ambao wanaishi na ukimwi. Tumeona pia serikali imeangalia mambo ya isolation and discrimination. This is Kenyan Swahili now. And that she has put a national committee and also a parliamentary committee to look at the issue. Both Tanzania Bara na Zanzibar. The government is commended for looking at legal issues, particularly on equal opportunity to employment of all Tanzanians, whether living with HIV/AIDS or not, and is commended for prohibiting segregation of people living with HIV and AIDS. We take note the increased access of services at service delivery points and health centers in the country, and the increased number of government expansion of services to people in general and to people living with HIV/AIDS in particular. We commend the government for its commitment to integrating people living with HIV/AIDS in the country, and we thank you for your intervention. Asante sana.
Thank you very much, Honorable Leta Moussini. Ceci nous amène à la fin de l'audition de votre rapport. La Commission vous remercie d'avoir présenté ce rapport et remercie aussi le Cameroun et la Tanzanie qui ont voulu interagir avec votre rapport. Merci beaucoup pour la présentation de ce rapport qui est très bien écrit. On passe à l'autre rapport, c'est le rapport du président du groupe de travail sur les droits économiques, sociaux et culturels en Afrique, l'honorable commissaire Matford Mwandenga. Collègues, vous avez la parole pour 15 minutes pour présenter, et puis il y a une longue liste des intervenants qui vont interagir avec vous. Vous avez la parole, commissaire Mwandenga, 15 minutes.
Thank you, Chair. Your Excellencies, distinguished participants, I am privileged to have been given this opportunity to tender my intersession activity report to this 77th ordinary session of the African Commission on Human and People's Rights. The report is submitted in accordance with the rules of procedure of the Commission, those that we adopted, and covers activities which I undertook during the intercession period between the 75th and the 77th session of the Working Group on Economic, Social and Cultural Rights in Africa, and Vice Chairperson of the Working Group on the Rights of Older Persons and Persons with Disabilities. The report is divided in three sections, and those three sections are divided in various parts. Section 2 has 3 parts, and Section 3 also has 3 parts. May I now go into the substantive report. Activities undertaken in my capacity as a member of the Commission and country rapporteur. From the 3rd to the 23rd May 2023, I participated in the 75th ordinary session of the Commission, which was held in the Gambia, wherein I contributed to the Commission's interactions with stakeholders on urgent human rights issues on the continent. I also held briefs with some delegates and representatives of national human rights institutions and non-governmental organizations on the human rights situation in their countries. Of course, I further participated in the consideration and adoption of decisions on communications and resolutions at that session. 76th ordinary session. On the 19th July to 20 August 2023, I participated in the 76th ordinary session of the Commission, which was held virtually, which discussed and adopted a midterm evaluation of the ACP-HR 2021-2025 strategic plan. And of course, we also considered communications and past resolutions and considered reports and other documents and matters arising from the Commission's 75th ordinary session. Country monitoring. As I've already indicated, I monitor activities in the countries that I have named, and that is in keeping with the mandate that I've been bestowed. In line with my mandate, I monitored the situation of those 5 countries, namely Ethiopia, Liberia, Malawi, Rwanda, and the Republic of Uganda. During the intercession period, I paid particular attention to the human rights situation in the respective countries, and in doing so, I issued a letter of urgent appeal on the human rights concerns which were brought to my attention, particularly in Uganda. Letter of urgent appeal to the Republic of Uganda. On the 19th October 2023, I sent a letter of urgent appeal in my capacity as chairperson of the working group on economic, social, and cultural rights, together with the Special Rapporteur on Human Rights Defenders and focal person on reprisals in Africa, and the chairperson of the working group on indigenous populations, communities, and minorities in Africa. We sent a letter of urgent appeal to His Excellency Yoweri Kaguta Museveni, the President of the Republic of Uganda, regarding the recurring attacks against the fishing community and human rights defenders in Lakes Edward and Albert region in western Uganda. Given the issues that were expressed and which caused us to write that letter of appeal, we made in line with Article 30 of the African of Uganda. I will just mention 3 of them. The first one was that the government of Uganda should take urgent measures to guarantee the right to life, physical and moral integrity, to protect the lives of the people in its territory. During that forum, the NGO forum, I was a panelist on the panel discussion on the rights and trades, reflecting on UDHR's 75th anniversary and its alignment with the implementation of the AFCFTA and the Africa we want. On the 17th October in Arusha here, on the margins of this same commission, I chaired the evaluation and planning meeting of the Working Group on Economic, Social and Cultural Rights in Africa. The meeting was organized, of course, to evaluate our work plan and also to plan for activities for 2024, and as well as to discuss terms of reference for the roadmap for the development of a study on economic, social and cultural rights. This is in conjunction with the Danish Institute of Human Rights. And we also took advantage of this meeting to meet the new members of the working group. From the 18th to 19th October, I participated in the 6th Nunnery Forum on the margins of this session. I also delivered the keynote address during the launch of the Nunnery DIH study on advancing the right to social security in Africa, state of implementation and guidance of the human rights institutions. From the 21st to the 22nd October, I participated in the validation meeting on the study on the impact of climate on human and people's rights in Africa, organized jointly by the Working Group on Extractive Industries, Environment and Human Rights Violations in Africa, and my working group. Then we go to strategic engagements with partners during intersession. There was a joint meeting on informal economy on the 30th of May 2023, in which I participated. Then we also had a continental workshop on the status of indigenous, which was conducted virtually. Then from the 29th to the 30th August 2023, I attended a regional conference on conflict, the case of extractive industries. Then we also had a closed meeting between experts from regional and international human rights systems from the 3rd to the 4th, 2023 in Switzerland, Geneva. My time is running out, and I would just say, under the situation analysis of ECOSOC's rights on the continent and recommendations, we did, during the intersession period, monitor the economic, social, and cultural rights in states parties to the Charter. And these issues which we looked at related to climate change, mental health, education, as well as employment. Then part 3, I'm drawing towards the end, Chair, opportunities which were seized by the... we took advantage of this and made advances in moving our agenda forward by doing quite a number of activities which I shall skip in the interest of time, and then go towards a conclusion. The conclusion, I think the ones that I wish to emphasize on will be as private actors that provide socio-economic related activities, and then create opportunities in particular for the youth, invest in women and the youth. They implement economic, social and cultural rights, and also to provide support to the world rights in the African countries where they operate. Lastly but not the least, may I...
I'm addressing the Commission on behalf of the Ethiopian Human Rights Commission. My name is Abdi. Honorable Commissioner, Honorable Chairperson of the Working Group on Economic, Social and Cultural Rights, all protocols duly observed, the Ethiopia is pleased to address the African Commission on the occasion of the 77th Ordinary Session on the situation of economic, social and cultural rights in Ethiopia. The Ethiopian Human Rights Commission during this period monitored the rights of workers in construction industry. They also conducted research on social rights and also published a short explanation on business and human rights, and released this first report on situation of economic and social rights in Ethiopia. Honorable Commissioner, allow me to highlight some positive development in these efforts to reconstruct health, education, and the transportation infrastructure that were affected by the conflict in the north. Resumption of classes interrupted during the conflict, taxes exemptions and other measures that were taken to reduce inflation in Ethiopia.
La délégation camerounaise voudrait se focaliser sur le droit à la santé, la prise de l'arrêté numéro 007/CAB/PM du 18 février 2022 qui a créé l'Observation nationale de la jeunesse. Pour terminer cette intervention, la délégation voudrait partager quelques données liées au droit à l'éducation. Nous rappelons ainsi que l'éducation est gratuite pour le primaire et que pour le secondaire et les établissements ruraux bénéficient également aux réfugiés et 371 établissements secondaires dont 2808 établissements publics et 1563 établissements publics. Cela constitue une hausse par rapport à 2021 où l'on comptait juste 4309